Hey everyone, in this video, based on the information that I'm going to be referencing from this particular article of the Toronto Sun, you're going to hear some information that's definitely going to outrage you. Rightfully so, I will add. I was outraged myself. The one thing though that I do want you to keep in mind when you're hearing this information is where you should prioritize your anger, your frustration, or your concerns. I think you'll kind of get to understand what I'm talking about as I read from this article. Headline of the Toronto Sun, Malcolm, docs show asylum claimant health access expanded to 20 years. This being reported by Candace Malcolm, March 7th, 2020. So yeah, this is going to be referencing the asylum seekers who have been pouring across the border for years now, basically unfettered, and using the Canadian Border Service Agency and the RCMP as quasi-administrators or baggage handlers for this illegal activity. Now, I'll be the first to admit, those asylum claimants, those asylum seekers who are pouring across the border from the United States, of all places, into Canada, illegally, once again I'll add, even though the media and the political class try to rephrase that and say irregular. But no, it's illegal. And it even says so on the sign down there at the border at Roxham Road. So yes, it's illegal. So these people are already doing an illegal act to begin with. Now, I'll be the first one to say that not all laws or things that are perceived as legal are truly so if there's no genuine victim involved. But as can be clearly demonstrated, not just by the information presented in this article, but many articles and other information that I've referenced in multiple videos in the past, there are definitely victims, many of them, millions of them, namely the Canadian tax serfs and wage slaves in this country, who are forced to not only pay for, but to compete with these people in the housing market, for jobs, or something even more powerful that has such a profound effect on all of us, which is that political power. Because let's remember, folks, in a democracy, majority rules, and numbers mean everything as to who gets to take over the reins of control, aka big government. But like I say, as much as we can blame these people because they're already doing an illegal act, I mean, surely they must know that when they're provided a lot of services for free, I mean, unless they're really, really, really stupid people, they must know somebody's paying for or providing those services. Because there's definitely a cost involved. Because yeah, in Canada, we do place value on people's labor. It's not a fully socialist country quite yet. So yes, these people definitely have personal culpability and personal responsibility in what they're doing. But like I say, even higher than this, I would place the blame, just like I used this reference when I was talking with another person, is yes, if I was walking downtown on Queen Street and I had my wallet hanging out of my pocket, very visible for everyone to see, and I knew it was a very high crime area, and I had stacks of $100 bills that was plainly visible by everyone in that area, yes, if someone came up and stole my wallet, yes, they would be directly responsible for stealing my money, and they should be held accountable. But I would also have to recognize that I played a big role of responsibility in doing such a reckless act in the first place. And like I say, that's just a very finite example between two individuals. When you're talking about government, especially under the Trudeau Liberals, although like I say, the Conservatives wouldn't be a whole lot better, maybe a teeny bit better, right? Lower it by what? A few thousand, the regular immigration, and what? The asylum seekers, would they close the border? No, none of them have ever said that they would close the border to the asylum seekers. So no, you know that the Conservative Party, or well, especially even the NDP party, you know none of the established parties in this country are willing to do anything to stop this kind of madness. And why? Because everyone in the political class, the bureaucratic class, and the public sector all benefit from this stuff. It all comes down to incentive at the end of the day. And for the overbloated bureaucracy or the public sector or those in government who have jobs as a direct result of this kind of illegality, the pencil pushers, the case workers, the welfare workers, the social workers. I mean, think about how many people benefit as a result of this kind of illegal activity. So like I say, the incentive is already completely upside down and in favor of those who are part and parcel of the connected or ruling class but a detriment to those who aren't. Anyways, like I say, culpability and responsibility needs to be spread around. And like I say, the number one culprit for this stuff at this particular time is the person that left the door wide open to the country of Canada under the current welfare state. Illegal border crossers and asylum claimants whose cases have not yet been heard in front of an immigration judge are in some cases being given 20 years of all access to gold-plated healthcare services, the Sun has learned. This provides access to every medical procedure available under the Canadian Health Act, as well as full dental coverage and taxpayer-funded prescription drugs, according to a medical assistant who is blowing the whistle on these exorbitant freebies. So think about that, folks. I know what really irked me the most about hearing this stuff in particular. It's not just the fact that they're already getting tons of services that even average Canadians are entitled to, which, once again, I'm already against all that forced wealth and income redistribution. I'm against it entirely. I support freedom and voluntary interactions, socially or economically, not forced association or forced wealth and income redistribution. But I mean, the fact that they're not only getting the services provided to them for 20 years, not just the fact they're getting the free healthcare and all that, you know, the welfare and subsidized housing. I mean, you know how many government programs there are in this country. A lot, right? A lot. And your tax bill shows that. Actually, it doesn't show it enough, because actually if your tax bill showed enough to pay for all of this stuff, well, the debts and deficits wouldn't be continually increasing. Your taxes actually would be in excess of 100%. You would never get a dime if you had to pay for this stuff in the here and now. The only reason why you're not feeling the full pain is because it's being spread over a long time frame. That's what those debts and deficits are. So even if you don't end up paying it, well, your kids or your grandkids will. But like I say, think about it. They're getting free dental care and free prescription drugs for 20 years. I'm a Canadian. I've lived here my whole fucking life. They've been forced to pay into these piece of shit socialist systems ever since I started working when I was 15 years old. And you know what? People in my family have had to go through, you know, my kids and my wife. There's been times when we just couldn't afford it. Dental care. Prescription, you'd have to scramble as best we could. If it was something that was deemed an absolute necessity, right? We would have to scramble, beg, borrow, and no, not steal because I'm not a thief, but do whatever you had to, sell things off to provide, you know, if someone needed a very important prescription. But dental care, like I say, even my wife, and myself included, but I don't worry about myself nearly as much as I do my family, but I'm just going to say, especially for my wife, that I love tremendously, you know, she has dental care now through her work. But for years, we have both had to put off dental care, much needed dental care, for the sheer fact that we just couldn't afford it. It was just outside of our reach economically. But yet people that pour across this border down that Roxham Road or all across this place, you know, out in Vancouver, I believe it's happening, in Manitoba, right? All across this country, when people are pouring across, they're getting this shit for free for 20 years. I mean, if that don't infuriate you, I don't know what, at this point, if this kind of stuff doesn't infuriate you, you might want to check your pulse, because you can't be alive. Or you just seemingly lack empathy or an understanding of economics entirely. This is outrageous beyond belief. And Canadians need to stop putting up with this stuff. The medical assistant who spoke to the Sun on condition of anonymity and provided supporting documentation to back these claims works at a medical clinic in York Region that takes patients covered by the Ontario Health Insurance Plan, OHIP. This one office in a town north of Toronto sees 30 to 40 migrants with 20-year permits each week, said the source. According to the whistleblower, migrants walk in the clinic and provide a government-issued identification number. When the number is inputted into the OHIP computer system, it shows what services the person is qualified to receive. They are eligible for everything for 20 years, said the medical assistant, who sent an example of a government certificate dated February 13th, 2020, that appears to provide health care until February 12th, 2040. The source sent a client profile page from Blue Cross, a medical insurance company that provides supplemental coverage that Canadians pay for out of pocket, which shows 20 years of coverage. So think about it. They're even talking about now coverage under what should be considered a private healthcare initiative. But they're getting that, like, yeah, those of us, which, yeah, I don't even have that. I can't afford that. But once again, these asylum seekers are getting that provided to them for free. Well, no, forcing you and I to pay for it. So we can't afford it for ourselves, but somehow we can afford to pay for it for these asylum seekers. Like I say, folks, some pretty crazy shit going on in this country these days. And Canadians better start waking up soon. The documents issued to an Iranian woman in her 70s makes it clear that she is an asylum claimant and has not yet been granted refugee status in Canada. The certificate was issued by the Department of Immigration, Refugees and Citizenship Canada, and it outlines the basis for providing free, unlimited, all-access health care to people who are not Canadian citizens or even permanent residents. The above-named individual is eligible for the coverage of health care costs under the Interim Federal Health Program. This coverage can be canceled without notice if the individual's immigration status changes, reads the document. The Interim Federal Health Program has become a political punching bag in recent years. The previous Conservative government canceled the program for migrants coming from safe countries and for bogus asylum seekers whose refugee claim had been rejected by an immigration judge. In a head-scratching ruling, a Liberal-appointed federal judge struck down the changes, stating it was cruel and unusual for the government to withhold free health care from illegal immigrants. So think about that. A Liberal-appointed judge. This is the part, this is the thing. To pretend that there's no bias in the judiciary is to, well, you might as well believe in unicorns, right? Because they are both a complete fiction. As this is being clearly pointed out. I mean, cruel and unusual to not provide health care at the point of the gun, right? Because that's the thing. No one is offering this voluntarily. It's government's going to force and impose this, right? It's a political edict. It's a mandate. That, to me, is cruel and unusual. Forcing the working poor or the unborn to pay for entitlements for illegal asylum seekers in this country. But this judge, as with a lot of leftists these days, has everything upside down and ass backwards. The Trudeau Liberals and much of the media doubled down on this twisted line of reasoning, insisting that the Conservatives had cut health care for refugees, even though the cuts only applied to individuals who were explicitly found not to be refugees. Trudeau has made significant changes to the refugee determination program, including eliminating a process that fast-tracked hearings and deportations for asylum claimants coming from safe countries. He pledged to keep the IFHP in place, even for bogus refugees and illegal migrants. According to the government's website, IFHP coverage is limited and temporary. But while it claims to be limited, it also outlines why migrants receive better coverage than Canadians. While basic coverage in Canada is similar to healthcare coverage provided by provincial and territorial health insurance plans, the benefits are not exactly the same. Benefits reflect the temporary nature of the program. 20 years isn't exactly temporary. I truly believe the general public is unaware of this, said the whistleblower. I was shocked when I learned about it, that we as taxpayers are paying for this kind of coverage and for that amount of time. Our veterans, Indigenous communities, single mothers, homeless and elderly do not receive such benefits, said the medical assistant. We all pay out of pocket for a lot of this stuff. The government acknowledged questions from the Sun about this 20-year access, but did not provide any comment or explanation as of the time of publication. Okay, first, the only thing I would suggest here is, I get it, and I'm with you on board, and thanks for reporting on this. Excellent article, right? Candace Malcolm, I believe it was the contributor here, right? Anyways, very appreciative of that. But, stop playing the identity politics game in any way, right? So forget about veterans, Indigenous communities, single mothers, homeless and elderly. No, all Canadians, right? And if we're all forced to pay into this system, then we should have equal access to this system, right? Not just picking special interest groups. What's wrong with a middle-aged white male like myself? Why can't you include us? Well, I get it. No, I totally get it. Yeah, who gives a shit about the typical middle-aged white male in this country? I totally get that. Whether you come from the right or the left these days, it seems that the middle-aged white man, which is who the hell I am, yeah, I get it. Fuck those guys, right? Who gives a shit about them? Yeah, okay, well, I totally get that. But, we do matter too. Matter of fact, it's people like myself who've had to carry the most weight, the most burden, that have built this fucking society that now exists today. All those amenities, all those entitlements, all that infrastructure, all those buildings, all those, everything. It's the average, typical, middle-aged white man that is assuming a bulk of the work to keep all this shit provided. Just keep that in mind sometime. Because yeah, we should be included when you're talking about this kind of stuff as well. Stop picking what's considered the popular go-to demographic these days. Like, just enough with that. Same with the whole bullshit pretense. If you listen to most of the people in the media, and I mean, just look at their ages, right? It kind of tells you a whole lot about that. Is there's only two demographics mostly that are adults in this country. It's the boomers and the millennials. Very fucking few times do you ever hear the word Generation X ever even mentioned. Why? Because we're a small cohort. We don't have enough of a population to be a threat politically. If we did, then we would be talked about. Then we would be catered to. Then we would be coddled in some way, right? But because we have no, even if all Gen Xers come together, millennials way outnumber us and boomers way outnumber us. So because we're a very small minority, it's like, fuck those guys. Who gives a shit? Hey, they got no power anyways, right? That's right. Hey, welcome to democracy. We're being the minority, and that's the thing. These minorities complain all the time. All these different special interest group minorities. But like I say, what about the minority of an entire generation that's up against the wall and bullied by seemingly both these days? Not all. Like I say, I'll put the exceptions, the outliers out there. Not everyone, not all millennials, not all boomers. But there's definitely enough of them who are vying to either maintain or assume control over big government. So maintain in terms of the boomers who've had control now for decades upon decades and decades, or the millennials, those big government proponents who want to take over and assume those positions for themselves. Like I say, Gen X, we may very well, unless we get our fucking act together and start doing some shit to push back against this nonsense, we may very well be one of those generations that are going to go our entire lives. Well, first we'll be ruled over and under the thumb of our parents' generation up until, middle ages. And then once you get that middle age point, well, it's going to be your kids that are going to take over that position, become your new fucking rulers. How do you like that concept? How do you like that idea? Well, that's going to be a reality. Like I say, if people don't start pushing back against this kind of nonsense. Anyways, folks, I'm a little heated because, this stuff really infuriates me, and it should you as well. And don't just consume my video for yourself. Share this shit. Share it around. Don't be shy. If you want to educate, enlighten, or open up the minds of people, you have to be willing to tell them some cold hard truth. And if you don't want to do it yourself, hey, I'm totally on board with you there, but at least let me do it by you sharing my video with them. Or, for that matter, bring them on, tell them to come and have a discussion or debate with me on my Canadian Libertarian YouTube channel. Because I'll have a discussion or a debate with anybody that promotes big government or supports this kind of nonsense. I don't care who they are, what their credentials are, or how old they are. Well, I don't want to debate kids. Let's stick with adults at the very least. But like I said, I'll place a link to this article in the description of the video below so that not only can you share the video, but that link will be right there in the description as a means of archive to keep this stuff front and center and never forgotten. That's the thing, folks. That 1,000+ videos that I got, that doesn't just reference articles and keep a link to those articles, but even if those articles ever cease to exist, in video form, you see the writing, the text is on the screen. And I have backup copies of all my videos. So this information, no matter if they ever try to wipe all this information clean, it's not going anywhere. Thanks to people like me who have been archiving this shit for years. A little thank you goes a long way, but some financial support would go a lot further and allow me to be able to continue to do this stuff. Like I say, folks, you got to prioritize some values. If what I provide you deem valuable, well, show me so by supporting me in some small way. Doesn't take much. $5 a month. Every little bit counts and helps. It's a Canadian Libertarian, and I love liberty.